What if the one thing keeping you safe from deadly diseases was suddenly called into question? Picture a world where a simple shot could spark heated debates, reshape public health, and leave millions wondering what's true. The conversation around vaccines and their safety is hotter than ever, and it's not going away anytime soon. Welcome to the Healthy Start channel, where we unpack the health topics that matter most to you. Today, we're diving deep into the swirling controversy over vaccines, the push to rethink vaccination schedules, and the role of figures like Robert F. Kennedy Jr. in shaking things up. This is a story of science, skepticism, and the future of our health. Don't miss it. Subscribe to the Healthy Start channel and hit that notification bell to stay in the know. Let's set the stage. Vaccines have been a cornerstone of modern medicine for decades, slashing death rates from diseases like measles, polio, and whooping cough. Think of a bustling 1950s classroom. Kids lined up for their polio shots, parents breathing sighs of relief as a crippling disease was pushed to the brink of extinction. Fast forward to 2025, and vaccines remain a marvel. Small doses of science that train your immune system to fight off invaders without making you sick. The CDC's current schedule recommends shots starting at birth, covering everything from hepatitis B to HPV, with most kids getting about 20 doses by age 6. Sounds like a slam dunk for public health, right? But here's where the plot thickens. Not everyone's on board. A growing number of people are questioning whether vaccines are as safe as we're told, whether the schedule is too aggressive, or whether the government should have a say at all. And at the center of this storm is Robert F. Kennedy Jr., a name that's become a lightning rod in the vaccine debate. So, who is RFK Jr., and why is he making waves? Kennedy, an environmental lawyer turned activist, has spent years sounding alarms about vaccine safety. He's not your typical skeptic. With a famous last name and a knack for rallying crowds, he's built a platform that reaches millions. His nonprofit, Children's Health Defense, pushes claims that vaccines are linked to everything from autism to immune disorders, often citing studies that mainstream science dismisses as flawed. In 2025, Kennedy's influence is peaking. Rumors swirl that he's pushing for a role at the CDC or even the Department of Health and Human Services, where he could reshape vaccine policy. Picture a conference room in Atlanta, CDC officials poring over data, while Kennedy's team demands a pause on certain shots or a rewrite of the childhood schedule. His supporters cheer, seeing him as a hero fighting Big Pharma. His critics, they're sounding alarms, warning that his ideas could unravel decades of progress. Who's right? That's the question we're unpacking today. Let's start with the heart of the controversy: vaccine safety. For most people, vaccines are a no-brainer. The science is clear. Decades of studies show they prevent millions of deaths annually. Measles, once a killer of thousands, is now rare in vaccinated communities. Polio, which paralyzed kids in the 50s, is nearly eradicated globally. Side effects, usually mild, think a sore arm or low-grade fever. Serious reactions, like allergic shock, happen in roughly 1 in 100,000 cases. But skeptics like Kennedy zoom in on the exceptions. They point to rare cases of Guillain-Barré syndrome after flu shots or seizures linked to certain vaccines in kids. They ask, are we overloading young immune systems with too many shots too soon? It's a question that resonates with parents staring at a pediatrician's needle, wondering if they're making the right call. The CDC says the schedule is rigorously tested, with each vaccine vetted for years before approval. Yet, for some, that's not enough. They want more transparency, more studies, or even the option to opt out. Now, let's talk about the schedule itself. The current CDC plan is a carefully choreographed dance, timed to protect kids when they're most vulnerable. Newborns get a hepatitis B shot within 24 hours to guard against a virus that can lurk in blood or bodily fluids. By age 2, kids are shielded against 14 diseases, from diphtheria to rotavirus. It's a lot, no question. Kennedy and his allies argue it's too much, too fast. They propose spreading out doses or skipping some vaccines altogether, claiming this could reduce risks like autoimmune issues or neurological problems. Picture a mom at a well-child visit, flipping through a vaccine booklet, wondering if she can delay the MMR shot until her kid's older. Sounds reasonable, right? But here's the catch. Delaying vaccines can leave kids exposed during critical windows. Measles, for instance, hits hardest in unvaccinated infants, with 1 in 5 cases leading to hospitalization. Mainstream experts say the schedule isn't arbitrary, it's built on data showing when diseases strike and when immunity is most effective. Still, the idea of a one-size-fits-all plan doesn't sit well with everyone. Another layer to this is trust or the lack of it. Vaccines don't exist in a vacuum. They're tied to institutions like the CDC, FDA, and pharmaceutical companies, all of which have faced scrutiny. Think of the opioid crisis, where drug makers were accused of prioritizing profits over lives. Or the early days of COVID, when mixed messages about masks and boosters left people dizzy. For some, these missteps fuel suspicion that vaccine science might be hiding something. Kennedy capitalizes on this, framing himself as a truth teller against a corrupt system. His ex-posts, often shared thousands of times, highlight parent stories of kids who change after shot stories that tug at heartstrings, even if the data doesn't back them up. On the flip side, public health officials argue that vaccines are the most studied medical intervention in history. Every year, the Vaccine Adverse Event Reporting System logs millions of shots with only a tiny fraction of issues. But when trust is shaky, numbers alone don't always persuade. Let's zoom out to the bigger picture. What happens if vaccine skepticism wins? The stakes are high. Community immunity, sometimes called herd immunity, depends on high vaccination rates. For measles, about 95% of people need to be vaccinated to stop outbreaks. Drop below that, and sparks become wildfires. In 2019, over 1,200 measles cases hit the US, mostly in unvaccinated pockets. Fast forward to 2025, and we're seeing similar flare-ups, with over 1,000 cases reported in a single month. Picture a small town, a single unvaccinated traveler bringing measles to a school, and within weeks, dozens of kids are sick, some in ICU. It's not just measles. Whooping cough, diphtheria, even polio could creep back if enough people opt out. Kennedy's push to rethink schedules could amplify this risk, especially if exemptions become easier to get. Already, 7% of kindergartners lack proper MMR records, a gap that's growing. Are we ready to gamble with diseases we thought we conquered? But let's flip the script. What's driving the skeptics? It's not just blind denial. Many are parents, educated and engaged, who've read studies, watched documentaries, or heard stories that give them pause. They're not anti-science, they're pro-choice, demanding the right to decide what goes into their kids' bodies. Picture a dad scrolling X late at night, stumbling on a post about a rare vaccine side effect, his heart racing as he thinks about his toddler's next appointment. For these folks, Kennedy's message resonates because it validates their fears. He's not alone, either. Influencers, podcasters, and even some doctors amplify similar concerns, creating an echo chamber that's hard to escape. The challenge: sorting fact from fiction. A 1998 study linking vaccines to autism was debunked and retracted, yet its shadow lingers. Modern studies, like a 2023 meta-analysis in The Lancet, show no link between vaccines and autism, but myths die hard. So, where does this leave us? The vaccine debate isn't black and white. On one hand, vaccines are a triumph, saving millions of lives annually. The CDC, WHO, and countless scientists stand by their safety and necessity. On the other, skepticism isn't irrational, it's human. People want to feel heard, not dismissed. Kennedy's influence, whether you agree with him or not, highlights a gap between public health and public trust. Closing that gap means more than throwing data at people. It means honest conversations, addressing rare risks head-on, and rebuilding faith in institutions. Picture a world where every parent feels confident in their child's shot, not because they're told to, but because they understand why. What can you do right now? First, get informed. Check your vaccination status and your kids. The CDC's website has clear schedules for all ages. Second, talk to your doctor, not not a blog, but a professional who knows your health. Ask questions, voice concerns, and dig into the answers. Third, think about your community. Vaccinating isn't just about you, it's about the kid next door, the grandma at the grocery store, the newborn who can't get shots yet. Fourth, push for transparency. If you want more data on vaccines, support policies and independent studies, or open up adverse event reports. And finally, keep an open mind. Science evolves, and so should we. This debate isn't going away. Kennedy's moves, whether at the CDC or beyond, will keep vaccines in the spotlight. Outbreaks like measles in 2025 show what's at stake if we falter. But there's hope, too. Every vaccinated person, every informed choice, every honest conversation moves us closer to a healthier future. Health isn't just about avoiding disease, it's about building a world where we trust the tools that keep us safe. So, take a step today. Learn, ask, act. Subscribe to the Healthy Start channel. Click the notification bell so you don't miss the next valuable videos. Goodbye and see you again.